Today we are going to study about the proton pump inhibitors. So let's start. So what are proton pump inhibitors? These are those drugs which inhibit gastric acid secretion in the stomach. It's belong to the categories which inhibits gastric acid secretion in the stomach. And what are proton pumps? These are the pumps which is also called hydrogen potassium ATPase present in the apical membranes of the parietal cells. These are the pumps which is also called hydrogen potassium ATPase, whose function is to secrete the hydrogen into the stomach lumen, and these are present in the luminal membrane of the parietal cells. Proton pump inhibitor include drugs like omeprazole, lansoprazole, rabeprazole, pantoprazole, and all drugs which ends in prazole, like esomeprazole, etc. The prototypic drug of the proton pump inhibitors, or PPI, is omeprazole. Now coming towards the pharmacokinetics of the drug, mostly the prototypic drug, i.e. omeprazole. So most of them are usually taken about 30 minutes before the breakfast, and they are vulnerable and they are degraded by the acidic environment in the stomach. So they are mostly present as enteric coated form, and this enteric coating is resistant to the acids. Or they may be taken as powder containing sodium bicarbonate, which neutralize the acid and thus prevent the degradation of the drug. And this enteric coated form, this enteric coating is removed by the enzymes in the alkaline duodenum. They are highly bound to the plasma proteins, and usually they are metabolized in the liver by the cytochrome oxidase enzymes. And after metabolism, they are excreted through the urinary tract. Coming towards its mechanism of action, how do they act on the hydrogen potassium pump, also called proton pump, in the apical membrane of the parietal cells? So first of all, this is the luminal side of the stomach. And this is the apical membrane of the parietal cells facing toward the lumen. These are called canaliculi. These are called the canaliculi. And this you can see the zoom part of the caniculi is containing the proton pump, which is also called hydrogen potassium ATPase. This hydrogen potassium ATPase works by secreting hydrogen into the lumen of the stomach and in exchange of the potassium in the lumen of the stomach, using the energy of ATP, which is converted into energy in ADP. Now when we take the drugs, they are usually in the enteric palm. They goes to the duodenum, where they are absorbed into the blood. Here you can see, for example, this is the capillary. From this capillary, the drug enters the basolateral membrane through the basolateral membrane of the parietal cells into the cytoplasm of the parietal cells. Here the drug pass through the apical membrane and enter the canaliculi of the parietal cells. Here you can see the drug pass through the apical membrane and enter the canaliculi of the parietal cells. Also keep in mind that protons, i.e. acidic environment, is required for the activation of Prazol's drugs, proton pump inhibitors. So when they enter the canaliculus, they are exposed to the acidic environment of parietal cell canalicus, you can see, and converted into the active compounds called electric sulfonide. This sulfonide form covalent disulfide bond with the hydrogen potassium ATPase, which is irreversible bond, and make them inactive. So they cannot secrete the hydrogen ions into the lumen of the stomach, and thus they prevent the formation of hydrogen ions. Also, very important point that as they act at the last step of acid secretion, hydrogen ions, i.e. acid secretion. So irrespective of the stimulus, i.e. it may be by acetylcholine or gastrin or prostaglandins, etc., they decrease the concentration and level of acidity in the stomach. Now coming towards the therapeutic uses of the proton pump inhibitors, so are they used in the peptic ulcers like gastric ulcers, duodenal ulcers, acute bleeding ulcers, for which IV proton pump inhibitors are used. H. pylori associated ulcers, stress ulcers, which is also called curling ulcers. And for the stress ulcer, they are used prophylactically to prevent stress ulcers, and also for the NSAIDs induced ulcers. So for all of these, like gastric, duodenal, acute bleeding ulcer, H. pylori associated ulcer, stress ulcers, NSAID induced ulcer, the proton pump inhibitors are one of the most important drugs. They are also used preoperatively to reduce the risk of aspirational pneumonia. They are used in the Zollinger-Ellison syndrome, in which there is hypersecretion of gastrin, and this gastrin stimulates the parietal cells to secrete increased quantity of acid. So giving the proton pump inhibitors can decrease the acidity in the stomach. But the most good and effective treatment for the Zollinger-Ellison syndrome is the surgery. They are also used in the gastroesophageal reflux disorders, which is also called heartburns. In the heartburn, they reduce the symptoms. They also heal the corrosive esophagitis, and they prevent the complications of the heartburns or GERD. Now talking about the side effects or adverse effects of the drugs, so they are usually well tolerated. Here are minor side effects like headache, diarrhea, abdominal pain, arthralgia, skin rashes, but on long-term uses they can cause decrease in the vitamin B absorption, so decrease vitamin B. This is due to the fact that acid is required for the absorption in a complex with intrinsic factor, because vitamin B12 complex required acid in complex with the intrinsic factor, so decreasing the acid and decrease the absorption of vitamin B12 and thus deficiency of vitamin B12. They also increase the risk of infections, usually hospital acquired pneumonia, because acid is one of the first line defense against the bacteria. Because acid is one of the first line defense against pathogens when they enter through the gastrointestinal tract to the body. The acids provide resistance against them. The acids in the stomach provide resistance against the pathogens. Also, they cause osteoporosis by decreasing the calcium absorption in the duodenum, and by decreasing the calcium absorption, they increase the osteoclast activity, which leads to osteoporosis. On chronic use, they cause hypergastриnemia. They cause hypergastриnemia, which can lead to gastric tumor, because gastrin is one of the most important and most potent tumor for hydrogen ion secretion. So decreasing the hydrogen ion will in turn stimulate the gastrin secretion, and this gastrin secretion will cause the cells to hypertrophy and can cause gastric tumor as well, and lead to hypertrophy, hyperplasia and gastric tumor, also called gynecomastia and erectile dysfunction, which is mostly associated with the prototypic drug omeprazole. So that's all for today.